camera here. Okay, so yeah, optional use of dumbbells, but feel free to not use any weights at all. And again, we're gonna move nice and slow today, and just pace yourself. So I suggest having a glass of water, a bottle of water close by. If you start to feel yourself get a little lightheaded, just take it easy and breathe. Don't push anything at all today. So let's start with a little bit of deep breathing. Plant your feet on the ground, sit up nice and tall, and we're gonna take a nice deep breath in. And out as you let your arms fall. In. Find these hot, slow days are really a great opportunity to just move a little slower, be a little bit more in tune with the body. Inhale as you lift, relax the shoulders, relax the neck muscles, and exhale. Let the jaw relax a little bit here. One more time. Inhale. And exhale. Okay. Now we're gonna start to open up the rib cage a little bit. So I want you to just give yourself a nice hug here. And you're gonna bend over to the side. So what you'll feel is a gentle stretch over one side of your rib cage. So just follow along with me. You're gonna take a deep breath in. Kind of visualize the space between each rib, get further and further apart with your inhale. On your exhale, you're gonna bend over even more in the same direction. Just a little bit here. Again, deep inhale. Bend over more with your exhale. 2 more times. Inhale. Exhale, bend over a little more. And 1 more time. So you should feel that stretch there. And exhale. All right, and slowly bring the body back to center. Okay, and if you'd like, you could switch which arm is resting on top. Again, we're gonna bend, take a deep breath in, and bend. So, guys, start to feel the stretch over top of your rib cage here. Now, whenever you take that deep inhale, you're gonna visualize the space between each rib get further and further apart. Exhale, bend over just a little bit more. We'll do that 3 more times. Inhale. Exhale, bend further. 2 more times. Inhale. And 1 more time. Deep breath in. Good. And we're gonna slowly stack the vertebrae back up. So you should start to feel that stretch, that opening of the rib cage here. Now we're gonna move over and stretch the back of the rib cage a little bit more. So we were kind of working into the side. Now we wanna get more posterior, so in the back. So what you're gonna do is you're gonna take one hand, or you can take both hands. I even like to support myself on my chair sometimes here. And what you're gonna do is you're gonna reach over towards the outside of the opposing ankle. So you're twisting your body, really stretching the arm, and you're gonna start to feel a stretch in the back of the opposite rib cage here. So if I'm reaching towards my left, I'll feel the stretch on my right side in the back of the ribs. And we're gonna do the same thing. So once you feel that stretch, take a nice deep breath. On the exhale, you're gonna reach down a little further. Again, from this new position, take a deep breath in. Exhale, reach down a little bit further. You can even use a little weight if you feel comfortable, but just take it easy. 2 more breaths. One more time. It should start to feel a little uncomfortable here. We shouldn't have pain. Very nice. Come on, back up slowly. Take your time as you exit. Move the rib cage around, and we'll do the same thing on the other side. So take your hand, Reach across your body, and you're reaching down towards your ankle. You don't have to touch it though. So reach down until you feel a stretch in the back of the ribs there. Breathe in. Breathe out. Reach a little further. You can kind of crawl down your shin. Breathe in. Exhale. Go a little further. It should start to get a little bit more challenging to perform your inhales. And exhale. One more time. Inhale. And exhale. And slowly come back up to a nice seated position. Again, just wiggle around the rib cage here. Let's do a couple deep breaths again, bringing those arms overhead. And I want you to really think of expanding your rib cage outwards. Now that they should be nice and stretched out. Good. Inhale. And big exhale. One more time. Breathe in, open up the rib cage in all directions. And exhale. You can place your hands on your lap. Good. Breathe in. When you exhale, bring your chin down towards your chest. Inhale, lift. You can look straight ahead or slightly up. And exhale, chin down. And feel free to just go at your own pace here, lifting your head up every time you inhale and letting your head descend every time you exhale. And you're moving nice and slow here. Two more. Good. Last one. After this one, we're going to do our neck rolls. So there, bring your chin down. This time when you inhale, roll your head off to one side, bringing your ear to your shoulder, feeling a stretch to the side of your neck. Exhale, roll back down. Inhale, roll to the other side. We're just staying within a nice comfortable range. You should be able to breathe very slowly and normally here. So every time you're lifting your head up to bring your ear to your shoulder, you're inhaling. Every time you're letting your head fall back down to your chest, that's when you want to exhale. And like I said, we're going to move nice and slow today, so just take your time here. We're going to spend more time with less exercises. One more time on each side. Very good. And slowly take your time to look straight ahead, sit up nice and proud, and you'll rotate your head from side to side. Try to keep your torso facing forward, and it's really just the head and the neck that's moving here. Again, you're not pushing through any pain. Just feel a gentle stretch and switch. And a great opportunity today to just move slow, start to pay attention to the body, pay attention to which side might feel tighter if there is. We're typically not very symmetrical, and that's okay. We're not designed to be symmetrical either. One more time on each side. look straight ahead. This time you're gonna lift your chin up, but if you'd like, you can take your hands and place them right on your breastbone, your sternum. You're gonna push in and pull down while you lift your chin up. You can think of lifting the chin nice and high, so you can think of pouting, or even just keeping the lips closed and the tongue glued to the roof of your mouth if you're comfortable with breathing through your nose, right? You're just going until you feel a gentle stretch. You're gonna hold that for a few seconds or a few breaths, and then come back down, right? And you're simultaneously pulling your hands in and down. Relax your jaw muscles and come back. Now let's look off to the corner of the room. So instead of looking straight up, you're gonna look up but off to the side. And you're gonna always pull your hands to the opposite direction. So if you're looking to the upper left-hand corner of the room, you're gonna pull your hands down and to the right. You're just creating some tension through your anterior neck. All right, don't go to the point where it's painful or you're finding it a little choky, right? You got lots of blood vessels and breathing tubes and swallowing tubes and nervous tissue, thyroid in here, speech is formed in here. There's a lot going on in the neck, so you want to keep it nice and slow. All right, now we're just looking straight up and back down. Very good. Okay, relax the neck, relax the shoulders, and you'll do some gentle rotations with the head. Now you can keep your eyes open or you can keep it closed, up to you. Well, we're moving slow. And pay attention to if there are any restrictions or if you have any discomfort in a particular part of this circle, in this range. And now let's go in the other direction. Again, moving very slowly, trying to be smooth with your movement. Relax the jaw. Start to feel how heavy the head really is here. And good, come back to center. Let's get the hands on the head like this. Now we're gonna take a deep breath in. I want you to recline and open up your shoulders, squeeze your shoulder blades together. Exhale, relax. Inhale, and exhale. Again, don't push it to 100% today, just gentle movements. Inhale, and exhale. Inhale and exhale. One more time. Inhale, squeeze the shoulder blades together just gently, and breathe out, exhale. All right, we'll get one arm out to the side. Imagine you're holding a cup of coffee here, and you're gonna roll forward with your shoulder, and you're gonna dump that coffee out on the floor. And then come back. Now you'll turn the other way, try to dump it behind. So notice this movement, I don't want you to just move your wrist, try to initiate the movement from the shoulder. So you should feel your shoulders moving too. Another way that you can think about it is, instead of holding the cup of coffee in your hand, imagine your shoulder, the cup of coffee is resting on your shoulder, and you're gonna try to dump it out in front. Good, cup of coffee here, dump the coffee behind. Okay, one more time. Roll forward and roll back. And let's just relax that arm. Same thing on the other side. So you're holding a cup of coffee either on your shoulder or in your hand. And we're gonna roll forward. That's called internal rotation. Come back. And now we're gonna roll back. You're gonna be a little more restricted as you roll back here. That's the external rotation. Internal and external. Yeah, nice and slow. In back. Okay, one more time. Roll, make sure you're moving from the shoulder joint, not just the wrist joint, and backwards here. Very good. Let's get both arms out. Now we're gonna go palms facing the ceiling. Good. Bring the hands together. You're gonna start to round your upper back. Roll. Get the backs of the hands to touch. So thumbs down, backs of the hands to touch. I'll just turn so you can see. See, I'm just tucking my chin in and really extending my fingertips. Then you're going to pull your hands apart, come back to that starting position, thumbs backwards, lift your chest up nice and proud, and breathe out, round. Backs of the hands together, reaching forward. Proud chest, arms back, and roll forward. Roll in, thumbs down, chin down. One more time. Open up, and round. Very good. Okay, shake, shake, shake. You can keep your hands on your lap here. Let's alternate with our overhead reach. So we're gonna reach overhead and pull down. Again, not pushing to 100% right here. Just keep it nice and gentle. We're just happy we're moving today, even if it's slow. Good, now let's reach forward. So you can lean forward a bit, reach, push your feet into the ground to come back. Alternate. Reach forward, push your feet into the ground to come back. Right, it's a great time to practice using the soles of the feet to drive your movement. Yeah, one more time, reach, and good. Now you're gonna turn your head, look behind you, and then reach back like you're reaching for something in the back seat of your car, and then come back. Again, turn your head first, turn your body. Reach for the back seat, and come back. Turn the head, reach. Turn the head, and reach. Very good. Turn, reach. One more time. Turn, and reach. Very good. Okay, grab some water if you need some. We're gonna get the hands on the back of the head again like this. Inhale, squeeze the shoulder blades together. Lift your chest up nice and high. Exhale, relax. Inhale. And exhale. Right, a couple more times. Inhale, gently squeezing those shoulder blades together. Exhale, relax. Two more times. Inhale, and exhale. One more. Inhale, and exhale. Good. Arm out to the side. It doesn't have to be completely in line with the shoulder. If you find it more comfortable to be down here, you're more than welcome to as well. Again, you're just imagining you have a cup of coffee resting on your shoulder and you're gonna dump it out. Come back. Now we'll dump it behind the back. Dump it in front and behind. You're gonna feel your shoulder blade lifting off your rib cage here and then coming back down onto your rib cage. One more time. In, internal rotation, external rotation. Good, relax, relax. Same thing on the other side. You can keep it up like this, or if it's more comfortable, you can keep it down too. Roll the shoulder forward, roll the shoulder backwards. Right, you're moving the scapula, the shoulder blade, very important bone in the shoulder. Back. And you can see how mobile it is. It's not just, it doesn't stay static on your body. It wraps around your rib cage, it glides around your body to allow your shoulder to move more freely. One more time, roll forward and roll back. Good. Shake, shake, shake. This one, palms up, thumbs back. Good. Round out here. Chin to chest, backs of the hands together. And then we're gonna pull through, palms up, thumbs back, and just go back and forth between these two positions. All right, one more time. Forward and lift up. And okay, shake, shake, shake. Let's reach overhead. Reaching up, pull down. Reach up, pull down. Continue to pace yourself here. You're just working within a very comfortable range. You're not actively trying to push your body today. We're moving slow and just paying attention to the way that we move. One more time on each side. Notice which movements feel more comfortable, which ones feel easier. Now let's reach forward. Use your feet. Push your feet into the ground to pull back. Right? Some movements are going to feel very exhausting. Maybe some movements will feel very nourishing. And we just want to pay attention to that. Maybe ask ourselves why. Is it because we're in pain? Is it because this is just a hard movement? Maybe there's some mobility issues that are restricting the way that we move, so we have to muscle our way through a little bit more. Maybe you have an injury. And come back. Good. Now you're going to turn your head first, look, and reach back to the back seat. Come back. And we're just going to alternate from side to side. The movements that you might feel most comfortable with are the ones that you spend the most time doing throughout the day. Right? Or maybe you've done a sport that has the same motion and you're really practiced in that. The body tends to do best with what it does most. One more time on each side. Reach back, return. Last one. Reach back and return. Very good. Okay, feel free to get a nice sip of water. We're going to move into the spine now. So place your hands on top of your knees, like this, moving really slow and gently here. Slouch into your chair, roll onto your tailbone, bring your chin to your chest. So you're really collapsing your spine forward like this. Okay, and then slowly you're going to transition to the other direction. So you're going to think of lifting your tail up if you had a tail. You're going to lift your chest to the ceiling, lift your chin, and take a nice deep inhale. Good. Exhale. Start to round your spine. You probably breathe in and out a couple times in the process of switching directions. Right, but you're moving really slowly and carefully here. Really thinking about moving each segment of the spine. So think about the vertebrae that live in your neck. That's your cervical spine. Right? Think about the vertebrae that your rib cage attaches to. So kind of from the neck to the middle of your torso. That's your thoracic spine. That tends to be a very stiff area for a lot of people. You're also moving your lumbar spine. That's the lower section of the spine that attaches to your pelvis and to the bottom of your rib cage. So we want all of these sections of the spine to be moving, bending back and forth here. Good. All right, and just slowly bring your spine back to a nice comfortable upright position. Let's take one hand, reach behind the head like this. Flare the elbow open, and then again, keep it gentle. We're rotating, looking over the shoulder, and come back. Switch. Hand on the head, elbow flares open. I want you to just go until you feel a gentle stretch. Pause there for a second or two, and then return. So don't push it very far today. There, open up, nice gentle twist. Feel a gentle stretch. Pause there for a moment or two. See if you can breathe comfortably. And then return. Again, here, flare the elbow open. Twist gently. And come back. Let's do that one more time on each side. Again, flaring the elbow open, rotating. And always breathing. Last one. Very good. Let's reach overhead. Feel a gentle stretch through the side of your body, kind of like what we did earlier when we were opening up the rib cage. Back and forth. You can place your free hand on your hips or across your lap, or just reach down towards the floor. You can always, if you have a leg of your chair, you can even grab the leg of your chair, or rest your hand on an armrest. All right, if you have to hold your breath for this, then we're going too far. So keep it in a comfortable range where you can just breathe. Okay, last one here, reach. And, very nice. Let's go back to our cat-cows here. So hands on the knees, like this. Let's round out the spine, let the chin fall to the chest. Again, think of each section of your spine. Make sure that each section is moving. All right, we're moving very slow. And you have muscles that live along the spine. They're called your erectors. They help to extend your spine. But you also have muscles between each individual vertebrae, right? Like your multifidi. These help to stabilize the spine and provide a little bit of movement. So we want to think about all of the structures that live between each vertebrae as well, and make sure that they're getting some blood flow, getting some movement, because that's what keeps our tissues healthy. One more time in each direction. Right, you have discs that live in between each vertebrae as well. So we want to make sure that that's also getting lubrication and blood flow. Oh yeah, and you also have your spinal cord living in between, so we want that to be moving as well, getting nourishment. Very good. Hand on top of the head, and we're going to rotate, so just a gentle twist. And come back. Switch. A nice gentle twist. See if you can take a nice inhale and exhale. One more time on each side. Twist. And one more. All right, we'll do our overhead reach. Reach, get the stretch to the side of the body, and again, we're just breathing comfortably here. If you feel like you have to hold your breath, you're going too far. Let's keep it a little more dynamic and fluid. Think of yourself as some seaweed, the bottom of the sea. All right, one more time on each side. And very good. Okay, shake out the spine there. Let's move into the hips. So let's start by just gently lifting the leg, opening up a little bit, tap the foot on the ground. We'll go a little bit further, and then one more time, 3. And then we'll come back in, lift and lower, kind of moving in thirds here. And then we'll switch to the other side. So lift, lower, lift, lower. Okay, try not to turn your chest. So you're keeping your torso facing forward, and it's just really the hips that are moving. Open, closed, close, close. Open, 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 close, close, and close. Very good. Let's just open up a little bit. So bring that leg out just to the side. So we're just gonna focus on one side at a time. You're gonna let the knee fall in and then open up. Fall in, open up. You can do a gentle push if you'd like, as long as that's not causing any pain in your hip or your knee. And then we can open up. Push in and open up. Right, you're really focusing on the hip joint here. Right, getting the head of the femur to move within the hip socket. The femur is the longest bone in your body. And good, okay, and then just give it a nice shake, shake, shake. Same thing on the other side, so we'll just open up a little bit here. Let the knee fall in towards your other knee, and then open up. You can use your hand to assist with this too, just to give you an extra little boost, but don't push too hard. Gentle stretch. In and out. In and out. One more time. In and out, and then just wiggle it back and forth, swinging the leg, being kind of loose with it. Good. Okay, now we'll shoot one leg out, point your toes. We're gonna lift the leg up and we're gonna draw some little circles. 1, 2, 3, 4, 5. Rest for a second, change directions. 1, 2, 3, 4, 5. Plant the heel down, give it a little wiggle, and switch. So other side, point your toes, lock out your knee, lift the leg. Doesn't have to be super high. 1, 2, 3, 4, 5. Rest and change directions. 1, 2, 3, 4, and 5. Wiggle, wiggle. Okay, now we'll go into a wide stance. So nice sumo stance here. You can even crawl your feet out just a little bit. Keep your back straight. This time we're not going to focus on folding forward so much. I want you to reach forward as much as you can, and then you're going to push your feet into the ground and row. Good. Reach forward, use your legs here, and pull back and row. Right, if you're feeling this in your low back, try to press your feet into the ground a little harder to take the load off. 2 more times. Inhale and exhale. 1 more. Inhale and breathe out and exhale. Good. Okay, bring your legs back in. We'll go back into our hip openers. So we're gonna lift and open 2, 3 times. 2 and 3. Back in. 1, 2, and 3. Other side. 1, 2, and 3. Bring it back. 1, 2, and 3. Let's do that one more time on each side. Back in. 2 and 3. Other side. 1, 2, 3. Back in. 1, 2, and 3. Choose a leg. We're going to open up just a little bit here. You're going to drop your knee in and then open up. This time I want you to be a little more active with it. So you're going to push your knee in and just imagine you're pushing against some resistance here. Hold it for a second or 2. And then now when you're going this way, once you've reached kind of your limit, you can't go much further, you're going to push it a little bit harder here. So you're going to actively engage some of those muscles. Bring it in, squeeze a little bit here. You're going to feel your adductors, the inner thigh muscles working. And then when you go the other way, you're going to feel the outside of your hip fire up if you're actively pushing out. 1 more time. In and out. Push out, push out. And good. And then just wiggle around here. Other side. So let's bring that leg back in. We're going to open up the hip just a little bit. Let the knee fall in. So I can be passive here. I'm not really trying hard. But now I'm going to think of pushing that knee in a little bit harder. So not too hard. but enough to feel some of the muscles working on the inner thighs. And now outside of the leg, I could be resting, or I'm gonna push out actively. You might feel your glute muscles engage here and the outside of your hip. In and out, so you're actively pushing out. All right, in, and last one, we're gonna go out, hold that open, and then just shake the leg, wiggle around, get some blood flow back through that hip joint, and good. Bring the leg in, point your toe, lock out your knees, and we're gonna lift 5 circles in one direction. 1, 2, 3, 4, 5. Relax and change directions. 1, 2, 3, 4, 5. Good. Switch. Point your toes, lock out your knee. 1, 2, 3, 4, 5. You can relax for a moment here. Just remember which direction you've moved in. 2, 3, 4, and 5. Relax. Wide stance, and if you'd like, just step out a little bit so you can see your toes peeking out from beyond your knees. Keep your back straight, arms in front. We're gonna inhale as you reach. Exhale. Pull back, squeeze the shoulder blades together. So really use the soles of your feet here. Push the soles of your feet into the ground to return. Inhale. Exhale. Breathe in. Breathe out. Let's find a nice rhythm to this. Always using the legs to come back. 3 more times. 3, 2, and last one. 1. Good. Okay, shake it all out. The next one we're gonna do, you can grab your dumbbells, but you can also just do this without any weight whatsoever. So we'll start with some gentle bicep curls. Keep your elbows connected to your torso here, coming up, and slow on the way down. 10 times. 1, 2, control it on the way down. 3, you can use a band for this as well. 4, 5, 6, 7, 8, 9, and last one, 10. Slowly lower. Good. Now we're going to bring the dumbbells up to the shoulders here. Keep your elbows close to your body. We're going to press overhead. 1, breathe out. 2, come back. Yeah, proud chest. 3, 4, good. 5, you can see how my arms are completely vertical at the top here. 6, if they're out like this, you're gonna have to work really hard to pull them in. So try to keep them right ahead. Okay. 8, 2 more, 9, last one, and 10. Good. Okay, just put the dumbbells off somewhere safely, shake that out. We'll do 2 big breaths in and out here. Breathe in and breathe out. So feel free, if you want to do the second round with no weight, you can do that. You can choose the same weight, or if you want to make it a little harder, you can pick up some heavier weights. Let's do the set of bicep curls again. So again, elbows connected to the body. We're going to curl and then slowly release. 1, 2, 3, 4. Try to relax your neck muscles here. Sometimes you just need to shake it out. 5. You don't need any of that tension right now in the neck. 6, 7, 8. 2 more. 9. And last one. 10. Always lower down first. Good. All right. Up to the shoulders here. I'm going to turn so you can see. So we want to also make sure that the weights aren't coming out in front. So we want to pull them back so that they're directly over top of the shoulders. 1, 2. This can be a little bit tricky to do. 3. So you might be limited by your shoulder mobility. 4, What you want to make sure you're not doing is coming out like this and then compensating by arching your back. So keep your back straight. 6, 7, good. 8, 2 more, 9, and last one, and 10. Good, okay. Put the weights down. Let's shake it out. Good, we're gonna do a couple of movements for the ankles. We'll do some squats and then we'll finish off there. So let's start by just lifting up the toes here, keeping the heels on the ground, slowly release. Lift the toes, release. You should feel the muscles in front of your shin working here. You can even feel the muscle engage if you find your shin bone with your fingertips, and then just come off to the side, the outside. You'll feel the tibialis anterior muscle in action here. Okay, hold it for 5, 4, 3, 2, and 1. Good. Now, keeping your toes on the ground, let's lift up the heels. Heels up. Using your calf muscles now. Right, if you want to make it a little bit more challenging, you can always take your dumbbells, place them right on your thighs for a little extra added weight, or you can stand up and do those too. Okay, so up to you. All right, this time we're going to hold. So hold for 5, 4, 3, 2, and 1. Good. Plant your feet on the ground again. This time you're going to roll out to the outside edges of your feet. So notice that my knees really want to open up. So what I'll do is I'll just take my hands and place them on the outside of the knees to prevent them from doing so that you can really focus on the movement of the ankles here. So you're lifting up the inside edges of both feet, rolling onto the outside. Okay, and this time we're going to hold for 5, 4, 3, 2, 1. Good. Now you're going to roll to the inside edges of your feet. You can see my knees want to come together, so I can take my hands and block them. You can also take 2 fists and place them between your knees. You'll have way less movement in this direction, and that's okay. You might not even feel the outside of your feet lift up very much or at all, but the intention is what matters here. Okay, that's normal. We don't want too much freedom to move in the ankles, or else it'll be very wobbly. Okay, and this time we're going to hold. So 5, 4, 3, 2, and 1. Very nice. Okay, plant your feet on the ground. Use your hands if you need to. You're going to lean forward, putting the weight into your feet. I'm going to slowly stand up. Take your time here. Very good. Okay, to come back, we'll pull the hips backwards. You can keep your arms out in front unless you need your hands to assist you in coming down. And sit. We'll do that 5 times. Lean forward. Good. Arms out. Don't worry about the arms too much here, but usually we use that to help us, and as we come up, the hands will come to the side. As you start to sit back down, the hands will come out in front. This just acts as a little counterbalance. 2 more times. Good, come back down, nice and slow. Last one. All the way up. And sit back down slowly. Very nice. Whew, good work, everyone. Let's take a couple deep breaths here. So feel free to recline. Feel free to even just rest your hands on your lap and just focus on the breathing if you'd like. Two more. Inhale. And exhale. Last one. Very good work, everyone. Thank you so much for joining today. I hope everyone's going to stay nice and cool.